thank today's event supporters. I don't know if you can see the whole screen behind me. I'm not on camera, so I can't see that, but these are our supporters. We have Bristol Myers Squibb. We have Mallinckrodt. We have Biogen, and we have Genentech. And virtually, let's give them a round of applause, all right? They did a great job in allowing us to be able to do this, and so we want to recognize them for what they are doing. Dr. Harris was awarded his Doctor of Psychology from Nova Southeastern University in 1982. Throughout his over 30 years of experience in the mental health field, he has worked in inpatient and outpatient settings with children, adolescents, adults, and seniors. From the beginning of his career, he has been interested in mind-body connection. As a consultant to the National Healthcare Company, he developed behavioral medicine programs for cancer, cardiac, GI, and primary care patients. And so let's now welcome Dr. Rick Harris, and he's going to be speaking with you for 35 minutes. Then we will do 20 minutes of Q&A. So take it away, Doc.
Thank you, Stu. First of all, I wanted to thank Stu and all the staff at MS Views and News for hosting this virtual seminar and this opportunity to share with you a topic that's really dear to my heart, and that is the mind, body, and spirit and its effects on chronic illness. Next slide, please. So when we look at any chronic illness, and even when we look at our own lives, we can break down causal factors or factors that affect our lives or our chronic illness into four baskets, if you will. One is I've labeled the biological factor. Second is psychological factor. Third is the spiritual factor. And the fourth is an environmental factor. And if you can take a look at the way I've diagrammed this, that there's a complex interaction between all of the four factors, that the biological factor can affect our psychological can affect our spiritual, and environmental. So it's a very comprehensive, complex interaction between all four factors. Next slide, please. So as a psychologist, I thought we would start with the psychological factors of the psychological impact on at least MS. Next slide, please. So when we look at the psychological factors, the first thing we need to understand is that mood disorders are extremely prevalent in MS. And when we talk about mood disorders, those are sustained and pervasive emotions that really influence our own perception of self, others, and the world, such as depression and anxiety. We looked at MS, the focus really has been on depression. However, anxiety is also important noted. So next slide, please. So I wanted to talk about depression because depression among MS patients, depression among MS patients is really prevalent. But so often we're asked, what is the difference between sadness and depression? Certainly we all have, or we get sad throughout the course of our lives. However, what's the difference between sadness and depression? So I wanted to talk about this so that you all can begin to recognize if in fact you ever get or have a depressive episode. So typically, what we see is to meet the criteria to major depressive disorder or to have clinical depression, you must be positive for 5 of the following symptoms. And these symptoms have to persist for a 2-week period. So the first one is experiencing a depressed mood most of the day or nearly every day. A marked diminished in interest or pleasure in all or most activities most of the day or nearly the day. So what that means is a loss of interest. I just don't have the interest in things that were previously interesting to me. We can also, with depression, we could weight loss. We can have weight loss where we lose our appetite, or we can also have weight gain where we find out that we are craving foods. And a particular sign of depression is simple carbohydrate craving. So we can see that either loss of appetite or increased appetite or symptoms. Feelings of agitation, where you just feel you can't sit still and are antsy, or is also a symptom. Or where it's difficult, where the common experience is more that you feel laden and heavy and can't move on. Another common symptom is fatigue. Next slide, please. So another three of the next symptoms are feelings of worthlessness or guilt, a diminished ability to think. Depression can affect our concentration, and recurrent thoughts of death. So certainly suicidal thoughts or thoughts that life is not worth living can also be a symptom of depression. So as you can see that the symptoms of depression are seriously different or consistently different than just a sense of feeling sad. All right, next slide, please. So when we look at depression with MS, we recognize when we look at the statistic, the diagnostic criteria that I just shared with you, the research has showed that depression, the prevalence rate among MS patients, is between 25 to 54%. That's considerably higher than the regular population, because in the regular population, you see for women 10 to 25%, and for men 5 to 12. So it's almost double in people who experience MS. When we look at other chronic illnesses, such as with similar rates of disability, such as arthritis, spinal cord injury, muscular dystrophy, MS patients have significantly more depressive episodes than patients with epilepsy or more motor neuron disease. In fact, 50% of all MS patients will experience one depressive episode throughout their course of their illness. There's higher rates of suicide among MS patients. What's really important, and the reason why I'm sharing this with you, is because so often the depression gets unrecognized by even our physicians. So it becomes so important to have this information so you can share it with your physician. When we talk about what's the causes of depression in MS, there's little really conclusive evidence to explain why the incidence of depression is significantly higher in MS patients than in other disorders with similar disability rates. We certainly know that at the time of diagnosis, there can be an episode of depression, a reaction when to the diagnosis, when there's relapses. We certainly know that changes to the brain occur with MS, which may be one of the causes, as well as medication side effects. So as you can see, depression among MS patients is common. Recognize the symptoms. Please talk to your physician if you have any of those symptoms we talked about. Next slide, please. So when we look at anxiety, it's important for us to understand, again, that anxiety is common among MS patients, and the research shows from 16 to 48%. And they're all often noted along the first time or the first symptoms of MS or the diagnosis. And it's understandable that emotions are linked to fear. As with depression, it can be due to the diagnosis, or a symptom of anxiety may come from things that occur during the MS lesions. Like depression, it can also be treated very effectively. Again, it's important to understand the symptoms of anxiety so that you can share them with your physician and be treated. So let's talk about the symptoms of anxiety. Next slide, please. So as we all know, experiencing anxiety is a normal part of our lives. It's part of the normal life condition. But when does anxiety become a disorder? The presence of anxiety and worry has to occur about specific events or activities for a 6-month period. And this is a diagnosis in which we call general anxiety disorder. There are many different types of anxiety disorders, but in general, these are the symptoms that are experienced with anxiety. And to obtain the diagnosis, you've got to have at least 3 of the following symptoms: edginess or restlessness, difficulty sitting still, feeling more fatigued than usual, difficulty in concentrating or feeling as though your mind goes blank, irritability, and that could be just your own perception or feeling. It doesn't have to be one that someone shares with you. It can just be that you have this feeling of irritability, that everything experiences, or your own experiences, that your fuse is a little shorter, or little things tend to irritate you. Insomnia, or difficulty sleeping, can also be a symptom of anxiety. Even if you're sleeping, but you don't feel like you're waking up rested, can be a symptom of anxiety. Next slide, please. And so the anxiety, worry or associated symptoms affect your day-to-day activities and responsibility. They may cause some problems in your relationship, at work, or other important areas. So it has to impact your daily life to become a disorder. These symptoms are unrelated to any other medical condition or a side effect of drugs or alcohol, and they're not better explained by a different disorder. So often I'm asked, what's the difference between anxiety and fear? So if we were sitting in our rooms right now, and all of a sudden we heard this incredible roar and the door came tumbling down, our bodies would respond, and it would respond with our heart would race, we may have difficulty breathing, we may break out into a sweat, we may have feelings of unreality and other additional symptoms. What's happening is our body is getting ready to fight or flight. It's getting ready to deal with danger. Fear is a response to actual danger. Anxiety is a response to perceived threat. So the difference is our perception. So often people will also say, okay, well, what's the difference between excitement and anxiety? The only difference between anxiety and excitement is our thinking about it. So if I'm standing in line at a ride like at Disney World, and my heart starts to race. And I say, oh my God, that's dangerous. That's anxiety. If I say, oh my God, I can't wait to get on that, it looks like so much fun, that's excitement. So much of anxiety is our cognitions, our thought. And a little later, I want to make sure I may leave out some of my presentation because I want to leave you with some specific skills and some techniques that you can use on your path to wellness. Next slide, please. The other thing too, when we're talking about psychological changes that can occur with MS, certainly we can experience a cognitive change, and they occur in some degree in 43 to 65% of all people with MS. And conventional MR technology is not sensitive enough to really detect some of the more subtle cognitive deficits. I'm having a problem with my microphone. You know what I'm gonna do? All right, that should be better. So we know that when we do MRIs, CAT scans, we're looking at structure. However, cognitive changes can occur due to function, and not necessarily or can related to the things that are picked up on MRIs or CT scans. Function is what really we deal with in life. So we may even have impairments, but no deficits in our function. 80% of all patients with MS are mildly affected to cognitive changes. And they kind of relate to our everyday activities and our quality of life. Research has found that if the way a person copes with this realization may provide a stronger association and help deal with these cognitive changes, as well as not lead to depression. Next slide, please. Most commonly reported difficulties with cognition, and these are really common among you all that are experiencing MS. Your memory can be affected. Your attention can be affected. More important, we call executive functioning, and that is planning and problem solving can be affected. Information processing can be affected. Word finding can also be affected, as well as my visual spatial organizational skills, my eye-hand coordinations. And just like any other symptom with MS, they can fluctuate, and they could be worse today, better today. And so often these cognitive changes may not be apparent. Again, may not be apparent bedside testing. And they also present a stigma for us. So often, I'm embarrassed or ashamed that I might not be able to recall names, words, memory. However, again, the whole purpose of me sharing this information with you is so that you know and begin to recognize some of the symptoms so that you can share with your physician. Next slide, please. Another common psychological impact of MS is what we call primary fatigue. And this is associated with the disease process. And, it's just part of the MS and can be a result of the MS. Secondary fatigue can occur with such factors as insomnia, As I shared with you, depression causes fatigue, and that would be secondary to the MS. And it's one of the most common, one of the most disabling symptoms. Prevalence among MS patients of fatigue is about 80%. Almost all MS patients at one time or another will talk about or experience and share that they experience fatigue. Now, fatigue, it's just not one dimension. It's complex and it's highly subjective. What we experience in fatigue is totally dependent upon our own experience. And as I said, it has many contributory factors. The disease severity, sleep, depression all contribute to fatigue. Next slide, please. So we've talked about some of the psychological factors that can impact MS, depression, anxiety, cognitive impairment, fatigue. Let's talk a little bit about another factor of environment. Next slide, please. So certainly, the diagnosis and the disease can impact our own environment. And these are just some statistics that's, again, important to recognize. And part of sharing this with you, too, is a sense that you're not alone. And, you know, one of the beautiful things about MS Views and News is it brings us all together and lets us know you're not alone in what you're experiencing. That's partly why also I'm sharing some of these statistics with you, is so that you get a sense you're not alone in this. There are other people that are experiencing. And then more importantly, there are people like myself and the physicians and the team that's on this panel that truly understand or try to understand what you all are going through. So when we look at the impact of MS, 27% of all MS patients experience a loss of personal income. 46% say it's impacted negatively their work life. 32%, you have to take time off somewhere along the course of the disease. 15% had to reduce their hours. 16% needed accommodations work. 1 out of 10 have had to stop work. 6% had to change careers, and 6% had to take a less demanding job. So the MS definitely can impact our environment. Now, we'll talk a little later, the environment can also impact MS. Next slide, please. And certainly, COVID has been the 300-pound gorilla in the room. Certainly, all of us have been impacted by this pandemic. I can't tell you in our private practice that exponentially how many more calls and patients we're seeing from young elementary school children to senior citizens, the sense of feeling isolation, alone, the loss of socialization, the loss of the ability to do reinforcing activities has affected each and one of us. How in our lives would you ever think that you would walk outside in our country and to look at people wearing masks wherever we go? It is so surreal. Next slide, please. But what is the impact? So there was a study done, and the data only went through July, May through July of this year. And what they did is they asked people if they were experiencing the symptoms of anxiety, depression, and combined since COVID, since the pandemic. from May through July. 35% of all responders said that they experienced the symptoms of anxiety. 28% reported feelings of depression. 40%, almost half, reported experiencing at least depression and anxiety. Almost 40% of the population. Let's take a look at what is the impact on MS patients. Next slide, please. As I said, we certainly recognize that the pandemic has affected each and every one of us. I mean, just look at how we're doing our symposium today. Typically, we'd all be together, we'd get to meet each other, we'd share a meal together, but we're having to do it this way so that we can be safe. So when I looked at, and these are me just kind of trying to get an idea of what the experience of an MS patient is, we talked about the MS prevalence rate of 20 to 54% of depression. The COVID prevalence rate is at 28%. That's an increase of 20% over the general population. Prior to COVID, only 8% of the population, 8 to 10%, report symptoms of depression. So if I extrapolate and increase the incidence of depression among MS patients, the incidence increases from 45 to 74%. When we look at anxiety, the study I shared with you, the studies I shared with you that the MS prevalence rate is 16 to 48%. COVID prevalence rate is about 35%, an increase of 17%, about 18% of the general population experiences anxiety symptoms. So we see an increase of 17%, so we can extrapolate and make the assumption that symptoms among MS patients have increased from 31 to 65%. And again, what contributes to this is the social isolation, the loss of reinforcing activities, and not only that, the frightening fear, the anxiety associated of having an underlying vulnerable condition also contributes to the anxiety and depression. Next slide. So let's take a look at the spiritual factor. And I want to just clarify that spiritual factor is not a religious factor. It's having a sense of who you are and how you relate to the universe. It's not a religious factor. It's really just about your own spiritual well-being. So let's take a look at that. Next slide. Next slide, thanks. So when we take a look at spiritual or psychosocial factors is the way I prefer to look at it. We know that social support has been associated with depression, and that the treatment of depression has been associated with utilization of social support. If you have a strong social support network, whether that is in your own community, whether it is your church, synagogue, your own family, we know that you're going to have lower levels of depression. And that if you have strong psychosocial support, strong spiritual support, that your adjustment is going to be much higher and much better. So it's important, and especially, we've talked about the effects of COVID on us and that it's really affected our social support, it is important to reach out, whether it's through virtual means or other means, to maintain that social support, because we certainly know it is more correlated with adjustment. Next slide. You know what? Let me go on the next one. I'm going to skip this one for now because I want to spend some time on this. So often, what can you do? What is it that you can do to help decrease the impact of the biological, environmental, spiritual, and psychological factors associated with MS? So what we know, and this is fascinating, we know that there are two different types of coping styles. And the way one individual copes is a predictor of the quality of life post-diagnosis and a strong indication of how well that person will cope and will go on to develop depressive symptoms or not. We can take a look and classify, in general, two different types of coping styles. One is emotionally focused. And emotionally focused copers, and as I talk about this, think about your own lives. Think about how you deal with things in your own life. So emotional copers tend to react emotionally. They also can be the ones that avoid unpleasant emotions. That is a least effective coping style. The other coping style that tends to be more effective and improve our quality of life and decrease the impact of the disease on us and our quality of life is what we call problem focused. The person that employs the emotion focused coping strategy tends to experience the negative thoughts associated with depressive order. Whereas the person who uses problem-focused coping may seek more information and social control and look at ways to solve the problem. When we look at people with similar situations, the person that uses the emotionally focused style tends to rate their situations worse. There's a strong relation between the illness perception, quality of life, and adjustment to diagnosis of MS. So several years ago, I was involved at the University of Miami in Florida in a study in which we were looking at the diagnosis of chronic illness or terminal illness on patients. And our hypothesis was that we would see that it impacted people's lives so severely that they had difficulty coping and handling things. But it was interesting because we found a group of people that after diagnosis reported improved quality of life. And we started to look at the analysis of those people, and they tended to be the problem-solving coping style. So we definitely had the research to say, if I can change the way I deal with something, my improvement in my life is so much better. Next slide, please. So let's talk about what you can do to change your thinking about MS, your thinking about life and stress. If I had one gift to give to each and every one of you out there, it would be this skill. And I'm going to walk you through this scenario, so bear with me if you would, because this can change not only how you deal with MS, but how you deal with life. So, when we think of time is an abstract concept. We've created time to coordinate events. I'll say to you, I'll see you next Wednesday at 7 p.m. That's an abstract concept that we've developed to coordinate events. But the only thing that really exists in time is this moment. This very moment I'm sharing with you is the only thing that truly exists. We can feel it, we can experience it, we can touch it. We have to ask ourselves, does the past exist? No, it's gone. Does the future exist? No, it hasn't happened yet. The only thing that exists in time is this very moment. If that's the case, we must ask ourselves, do I have control of the past? No, we don't. The more difficult question is, do I have control of the future? And the answer to that question is no. We'd like to believe we do, but certainly this pandemic has brought to surface we really have no control of the future. But that doesn't mean plans or goals are not important. They are in life. But there are subjective reality. They're what we'd like to see happen, but we have no control of the future. So we need to be mindful that whenever we hear ourselves say the words, God, I could have done that, I should have done that, we've put ourselves in the past, which we have no control over, and caused ourselves to feel guilt or shame. The more important words to be aware of and recognize are what I've come to call the what if thinking. What if thinking? The minute you hear those magic words, you need to realize you've taken yourself out of this moment, right here and now, and put yourself out in the future that you have no control over, and caused yourself in this present moment anxiety. Becomes important that you become extremely mindful and aware. Whenever you say what if, you're putting yourself out in the future, causing yourself in the moment anxiety. The only thing we truly have control over in our lives is this very moment. So when I hear the words what if, coulda, shoulda, I need to say to myself, stop. The only thing I have control over right now is this very moment. A good question is, what can I do about that? And so often with chronic illnesses, we're what ifing ourselves to death, literally. We're what ifing ourselves to anxiety and panic attacks. What if I get worse? What if this? What if that? Stop the only thing I have control over. I can't predict the future. Be here now. That's the most important thing we can do. Let me take a look at this. I think I only have a couple of minutes. Go to the next slide. I'm going to, and go ahead, please, slide. I'll tell you when to stop. Next step, stop, perfect. So we've talked about what you can do to change your thinking. Now, I'm going to ask you to participate with me, and I'm going to ask you to try a little technique. This is a technique that can be used to change your physiological reaction to stress, to anxiety. Research has shown that if we can do this technique, we can decrease our levels of stress, decrease our levels of cortisol, etc. And it's called belly breathing, affectionately known as belly breathing. I'm going to do this for 1 minute, and then we're going to go to questions. So when we do belly breathing, there are apps that you can get for your iPhone, belly breathing. What I'm going to ask you to do is put one hand on your chest, one hand on your diaphragm, and we're going to breathe together, but we're going to fill up that belly. We're going to fill that belly full of air. We're going to expand that diaphragm. So we're going to first exhale together. And now we're going to inhale through our nose. Soft belly, relax the belly, expand the diaphragm, and exhale through our mouth very slowly. Inhale through our nose. Soft belly, relax the belly. Exhale through our mouth. And the exhale should be longer than the inhale. If you get an opportunity, try that, and you're going to be fine that it can relax your body. Dr. Jacobson, a very famous psychologist, said, a busy mind cannot live in a relaxed body. So I'm going to end my presentation now, and we're going to move to some questions. So I appreciate your attention. And Stu?
Hi, how are you? All right, let's thank Dr. Harris for being online. I can't hear what he's saying, so if I'm talking over him right now, I'm sorry for that, but he speaks very low. It's hard to hear him, right? No, I got it. Dr. Harris, thank you again for being with us. It was awesome to have you from North Carolina talking with us and empowering the MS community. And now, I'm not giving total thanks to him because we have questions and answers to do with Dr. Harris now. All right, so we're going to be doing this for about 15 minutes. Jennifer is up first. She'll be taking the first 2 questions, giving them to Dr. Harris, and then we'll have Jill online as well. All right, so Jennifer, take it away.
Hi, Dr. Harris. How are you?
Good, Jen. How are you? Long time no see.
Thanks. I'm relaxed and I'm belly breathing, and I thank you for giving us those direct tools to use. That's very helpful.
My pleasure. My pleasure.
So we have a lot of questions that came in prior to this talk that you gave, and I think that they all directly apply. So the first question is, can you please address isolation and anxiety during these times? And I know that's something that you touched on, but I think it really validates the experience of our attendees today, for sure.
Yeah, as we've talked about, certainly, I mean, we all have experienced this sense of isolation and being alone. That I know one of the things, and I'm going to share personally, what I've done is I can't visit my family, my dearest friends. We haven't been. So what we've done is almost every Sunday evening, we have a virtual happy hour. My family gets together. I have a daughter in Baltimore, son and daughter-in-law in Cincinnati. Her brother is in Fort Lauderdale. We do a little virtual together. And so it's not the same. I miss those hugs, but at least it maintains that connectedness. I'm sure that there are virtual support groups for MS, and reach out, see those so you don't feel isolated. That's what you can do.
Okay, thank you. And I know you gave us some tools about dealing with anxiety. And what about racing thoughts, especially in the middle of the night?
There are some really good techniques. One is we introduced you to is the belly breathing. There are also meditative the app stores. I remember when I first got my iPhone, I won't date myself, but it was about the time we discovered the wheel. There was only like 4 or 5 apps at the App Store. There are some wonderful apps for mindfulness, meditation, relaxation. So you can use those to help stop racing thoughts. The one technique that I love to introduce is don't try to stop the racing thoughts. If I would tell you, each of you out there now, please don't think of a pink elephant. What happened? You thought of a pink elephant. One thing you can do is to imagine that your head is a room. There's a window on one side and a window on the other side. And imagine that the thoughts just come in and they go out just like a breeze. It can be helpful in not allowing those thoughts to occur. If the thoughts continue to occur, it's important maybe to take a look at if it's associated with an anxiety disorder and may require some treatment.
Thank you so much.
Sure.
I'm going to see if Jill is taking the live questions that are coming in. Jill, are you there?
I'm here. Hi, Dr. Harris. Do you have a good book that you would recommend to people?
I got one better. I got a great song
Okay.
that you can download and use to help with anxiety. There's one of my favorite artists. His name is Jason Mraz. And Jason has a song called Living in the Moment. And when you start to find yourself worrying about the future or feeling guilty about the past, download or listen to this song. I think you'll find it extremely.
Sounds great. Thank you. One more question. How do people living with MS feel, or actually it's do people living with MS feel supported regarding mental health?
Do they feel? I would hope so. If they're not feeling supported, again, it's important to reach out. We know more about mental health today than we did 20 years ago. And we've come to recognize how important mental health is in the core and in quality of life and predicting a disease entity. And if you're not feeling emotionally supportive, there are professionals in every community that can provide you with that emotional support.
Great. Thank you so much. Jennifer, we're going back to you.
Okay, let's see what we've got. Okay, I am at times hit by a pervasive mental and emotional fatigue. I know how to rest and recover from physical fatigue, but are there relaxation practices that can help me deal with emotional lassitude?
Absolutely. We did one earlier. The belly breathing is an incredible relaxation technique. As I said, a busy mind can't live in a relaxed body. Yoga. Yoga is a great tool to help with relaxation. And there are all different types of yoga. There's chair yoga, there's yoga for people that have one nostril bigger than the other nowadays. That's real important. And the mindfulness techniques that you can see on the App Store can be really, really helpful as well.
Wonderful. Thank you.
Uh-huh.
And then the next question I have is, looks like it's more about communication. How can someone get their family to understand how MS is affecting them when you have always done so much and now you need help?
Gosh, that's such an important question. Two things come to mind is learning when you've been so competent, and so often we see MS, rob us of some of the things that we value in life. It becomes so important that we are and learn to be able to ask for help and accept our own limitations. Information, education is so important for families, and the ability to feel comfortable enough to ask for them. And if you can't ask, tell the family, I can't ask, so that communication becomes so important. And again, I plug mental health professionals. If it becomes an issue among the family, their marriage and family therapists can be very helpful in facilitating communication.
Thank you. And Dr. Harris, I know the last time we were online together, you shared with the audience some recent changes in telehealth and mental health services. Could you just kind of give a quick review of that? Because things have changed since COVID, and I think that's so important.
So, yeah, Jen, I could never have imagined practicing the way I practice today. I could never imagine delivering, psychological services through a computer. Since March 15th, that's all we've been doing in our practice. And what's really cool is the insurance industry, the third-party payers, has supported that. So it's kind of cool. My office is in Weston, Florida, but I'm now in the mountains of North Carolina and have been since June, and been able to practice and provide that support. And so we actually run groups virtually now. We do individual therapy virtually. We do couples therapy virtually. It's really changed how we practice. Yeah.
Okay, wonderful. So that's also a resource that people can consider, even locally on a state level, wherever you are, that this now could be covered under insurance. And if you're experiencing new mental health challenges, that's a resource that can be tapped into now.
Yeah, absolutely, Jen.
Great, thank you. Jill, how's it going on that end?
I have one more question. Actually, I have two. What could you recommend to parents who have a child with multiple sclerosis, and those parents are feeling very depressed? Do you have some suggestions for them?
Yeah, I think that, again, if the parents, we need to take a look at, and where along the disease is this? Is it at the beginning of diagnosis? Is it longer in the progression? And so a common response to diagnosis, whether it's a family member or the individual, is grief and sadness. And so it's a loss. And so the family also, and this is so interesting that this question is brought up, because so often the families are neglected in support services. The identified person that has the MS gets the support, but this is so important. And so the family members need to take a look at, is it depression? Is it grief? Is sadness? And again, as Jen said, they can reach out to a professional that can just help them understand what's going on and what the root of that depression might be.
Great, thank you. Now, would you say the same thing for the siblings of that person who has MS?
Yeah, I would definitely say the exact same thing. You know,
Great.
relationships change. You know, people, we have to understand that families are systems and dynamics. And when one person in that family has a change, it affects each and every one and their roles, their responsibilities. And it may be that individuals in that family system are having difficulty accepting maybe new roles and responsibilities. So the recommendation would be the same.
And how would that family deal with acknowledging it to everyone? Would the parents be teaching about it to the younger children or other children?
You know, I always suggest that, you know, the family get together and talk. And it might be that we share that, you know, your older brother or older sister has been diagnosed with MS. Let us tell you what MS is. Let's have an open discussion about it. And more important is to allow those siblings, depending upon their ages, to have an opportunity to ask questions. So often, fear is not based in reality. The fear is based on perception. And so having and being able to provide that information can be helpful for every family member.
Great, thank you so much. Jennifer, we're going back to you.
Okay. Well, I think we've covered a lot of this, but if you have anything to add to the best ways to deal with stress during these uncertain times.
So yeah, certainly. You know, we talked about, you know, today there's this push to wellness. And wellness is really about dealing with stress. So one of the great stress management techniques is learning the ability to relax, as we talked about. Exercise. And when I say exercise, it doesn't even have, it's not going to the gym and pumping iron. It's just moving your body. If you're having difficulty with mobility, it may be chair exercises. It may be just walking for 10, 15 minutes a day. The correlation between exercise and stress management is really, really high. Also, eating healthy. If we're eating junk food, processed foods, our body is getting stressed by the very intake of food we take. So trying to eat healthy. So again, biological, psychological, and then also reducing the stress in the environment can be really helpful.
Okay. Well, thank you, Dr. Harris. We really appreciate you joining us for this symposium. This has been excellent.
Thank you. All right. I just want to thank everybody, all right? It's not just our supporters. We have Bristol Myers Squibb. We have Mallinckrodt. We have Genentech and Biogen, okay? We have all of you, okay? We can't do these programs without you, okay? We have our presenters. I want to thank them. And I do want to thank our staff who's been working with this program today. Of course, Jennifer and Jill doing so much with all of our programs that I just want to say thank you to all of them. I want you all to know it is not easy. If you watch virtual events, it is not easy to go from performer to performer to performer or presenter to presenter to presenter, okay, so seamlessly as what we have been able to do with this program where we have not had a hitch going or something negative going on. And for that, I have to again thank our video producer, Bill Shanley, who's the president and CEO of Orlando Production. And yes, I'm giving him kudos because he deserves it, okay?